I may be the earliest person in this room to have built collaborations with the medical campus who's actually still here. We can talk about that over coffee. So when you ask a physicist what is cancer, they produce simplified images. And this is a physicist's cartoon, which is showing us that what we know from the histopathologists is that when they're looking for distinguishing cancer from a normal cell, they look at enlarged nuclei, clustering patterns, granularity of the chromatin, and fancy words like that. Well, these are things that affect the way light scatters from tissue. If you change the structure, the microarchitecture of the cells, they'll scatter light differently, and it'll scatter different wavelengths with different light probabilities. So we build this. This is deceptively simple. You have two optical fibers. One brings broadband white light to the tissue, and the other one collects. And then it goes to a spectrometer, and then you use a lot of fancy AI to analyze it. So we've built optical fiber probes into flexible things that go into endoscopes or needle-based probes. And for example, this is a system that was built into an FNA needle for thyroid nodule assessment. And we can actually build the fiber probes into surgical tools that go through an endoscope, such as a forceps. Then you go into the other parts of the body that are not so readily accessible through endoscopes. Then you will need to use very fine needles. We're working with another group, collaborating with another group, to come up with ways to assess chronic kidney disease, and in particular, to assess whether transplant kidneys that are normally discarded could have been viable, because it turns out afterwards they find out that 80% of the discarded kidneys were actually viable and could have been transplanted. And that's a horrible loss of a very precious commodity. So we're working with another group on coming up with optical methods to improve our assessment of the health of a kidney. And we've shown that we have a very good correlation between our optical measurements and the standard histopathology score of interstitial fibrosis and tubular atrophy. So, wow, that didn't work in that color. Okay, so a variety of applications come out of this. This is a platform technology, and there are a lot of applications for it. So, identifying margins in oral cancer. We have an ongoing collaboration with Dr. Griloni and colleagues in the surgery department. We have collaborations in the kidney transplant, thyroid nodule diagnosis, tool and lesion verification for interventional radiology procedures, tissue identification during robotic procedures, a variety of things. Skin cancer detection, which you may have heard something about recently, because this company called Dermasensor licensed our technologies from BU and developed the product that was actually clinically friendly and got FDA approval a year ago. They're now in I think something like 500 clinics already, and have already discovered many cases of cancer that would have gone undetected.